This is our presentation for the Phlebotomy Sum It Up, presented by, of course, your one and only FNO Academy. And this is Milka. Now, we're going to go through a series of terms that you do need to know when it comes to the phlebotomy exam. Let's focus on these terms here. Although there is a lot to know when it comes to medical terminology, but we're going to simplify what we really need to know. First off, we're going to start with hypoglycemia. If we break down the term, hypo stands for low, glycemia is blood sugar. We put those terms together and it becomes the low blood sugar. Hyperglycemia, hyper stands for high. Glycemia, again, is blood sugar, which is high blood sugar. When you come across these two terms, they are most likely going to introduce to you the gray top. The gray top, which is a sodium fluoride, potassium oxalate tube. This tube is used for glucose. The next term we have is anticoagulant, meaning against clotting. We have our anticoagulant tubes, which is the light blue tube, the green top, your lavender, your pink, and your gray. Next term we should focus on is hepatitis. Hepatitis is the inflammation of the liver. Anytime they talk about hepatitis on the exam, know that they're mainly focused on HBV, which is Hep B. Our next term is sepsis. Sepsis is poisoning in the blood. This term will be introduced when they'll ask you any type of questions when it comes to blood cultures or your yellow top, which has an additive of either ACD or SPS. Fomite, an object that can carry a bacteria or germ. So a fomite can be an example of your table, a doorknob, your phone, anything that's an object that can hold a bacteria. Vector. Vector comes from an insect that carries the disease. For example, like a tick. A tick can carry Lyme's disease, which is considered to be a vector. Nosocomial, also known as hospital-acquired infection. For example, you go into the hospital for one thing and you're leaving with another. Some type of infection occurred at this time. Hypolipidemia. Let's break down this term. Hypo, meaning low. Lipidemia, that's cholesterol. So, it's low cholesterol in the blood. Hyperlipidemia is high cholesterol levels in the blood. When these two terms come across, know that they are talking about lipid, which is cholesterol. Lipid could also be broken down into LDL, HDL, and triglyceride. Edema. That's the inflammation or the swelling inside of a tissue. And hypochlorite is bleach.